Welcome to this Strength of Science audio abstract. I'm Nicol, a physio at the Aspetar Sports Medicine Hospital in Doha, Qatar. I'd like to acknowledge all the co-authors on this work, as well as the club medical staff and screening department at Aspetar, without whom this investigation just wouldn't be possible. The title of our paper published in BJSM last year kind of gives it all away. We looked at a range of strength tests in predicting risk of hamstring injury in professional football players. The reason why we felt this study was important is that previous work is really underpowered. To look for small or even moderate associations, you need a large cohort of players and also a high number of injuries included in the analysis. If you scroll down to the abstract, you'll see that we were able to do that. I must just mention that there is a pretty unique situation in Qatar as well, where all the players that compete in the Qatar Stars League, that's the premier competition in the country, have their annual assessment or periodic health evaluation done at the hospital. So we're really able to include almost all the league. Now, we looked at isokinetic Nordic hamstring strength as well as different iterations of the hamstring quadriceps ratio. And we only found one out of the 24 strength variables associated with injury. Concentric quad strength when tested at 300 degrees per second adjusted for body weight. None of the other strength variables were associated with an increased risk of injury. I'm going to highlight just a couple of things in our results section. You can find the demographics of the players there, also those that were excluded, who's pretty similar. So we don't think that influenced the results. And that's a pretty normal football league, I would say. Our non-modifiable risk factor findings were interesting because we didn't find previous injury associated with risk of injury. Now, as you might know, previous injury is usually one of the strongest risk factors, but it's usually prone to recall bias by either the player or the staff. So, because of our injury surveillance program that's been running a few years at Aspetar, we also had a subgroup of players where we were absolutely sure about their previous injury history. And even here, we didn't find an association with risk of injury, hamstring injury. Table 2 shows the variables when categorized. So we took the mean of the group, and if you were one standard deviation above the mean, you were considered in the strong group, and one standard deviation below the mean, the weak group. Now here we find our one variable, concentric quad strength, and you were 2 times as likely to have an injury. And this fits nicely with previous findings from a meta-analysis by Grant Freckleton and Tanya Pizzari, where this was also the only modifiable risk factor identified or associated with risk of injury. The real important thing here is that none of these other factors were associated. And so this one isolated factor out of this host of strength variables does not paint a strong picture. One of the strengths of this investigation was that it was performed in a clinical setting. Um, and that means that this is probably pretty transferable to everyday practice. That also creates some limitations because you cannot control everything in the clinical setting when you're doing this kind of analysis. But I think that really reflects a real world scenario. And because the size of the sample and the number of injuries included, this data set was probably able to absorb some of the noise we would expect in this kind of investigation. So, what does this mean practically for us? Firstly, doing isolated strength measurements cannot predict risk of hamstring injury. The injured and uninjured players were distributed almost exactly the same across the strength variables. And only one out of the 23 were found a statistically significant association. Um, then I would say that there are other reasons to do strength testing, detecting ongoing issues or baseline testing. But I think the shift now is towards monitoring strength. So if you are measuring your player's strength, it's important to see how this strength changes over the season in response to their workload. And I think this is where we might find better results, better analysis of players who are at higher risk of injury. The previous injury finding is explained perhaps by the fact that there are two randomized controlled treatment trials being run at Aspetar at the moment. So most of these injuries would have ended up in this criteria-based rehab program, even the control group. And to the clinician, I would say that means that if you're doing proper rehab, you might actually reduce the risk usually associated with previous injury and protect your player from future injuries. And that's an important message for us in terms of the treatment of hamstring injuries. I hope you find this abstract useful. Please go to strengthofscience.com for other really great audio abstracts. And kudos to Rob for this great platform and this great idea in disseminating scientific evidence. You can find me on Twitter at Nicol van Dijk, on ResearchGate if you want to contact me, and look forward to sharing more of our work in the future.